Hello everyone, welcome again to another topic for our psychiatric nursing. This time we talk about the somatic symptom illnesses. In this topic, we need to explain what is the meaning of psychosomatic illness, describe the somatic symptom illnesses and identify their three central features, discuss the characteristics and dynamics of specific somatic symptoms, illnesses, distinguish the somatic symptoms, illnesses from factious disorder and malignity, and discuss the etiologic theories related to somatic symptoms illness. So these are the learning objectives that we need to meet on the somatic symptoms illnesses. In somatic symptoms illnesses, in the early 1800s, the medical field began to consider the various social and psychological factors that influence the illness. So, the term psychomatic, that is the connections between the mind and then the body, which is mind, which means psyche, and body, which means uh, soma. So, to convey the connection between the mind and the body in a state of health and illness. Essentially, the mind can cause the body either to create physical symptoms or to worsening worsening the physical illness. So the real symptoms can begin, continue, or be worsened as the result of emotional factors. So example includes the diabetes, the hypertensions, and colitis, and all which are medical illnesses influenced by the stress and emotions. So when a person is under a lot of stress or is not coping well with the stress, the symptoms of these medical illnesses is worsened. So in addition, stress can cause physical symptoms unrelated to diagnosed medical illness. So after that, a stressful day at work, many people experiencing tension headaches that can be quite painful. So the headache are manifestations of stress rather than as symptoms of underlying medical problem. Okay, so that is psychomatic. In the hysteria, in hysteria that is refers to multiple physical complaints with no organic basis. So the complaints are usually described dramatically. So the concept of hysteria is believed to have originated in Egypt and is about 4,000 years old. So in the Middle Age, hysteria was associated with witchcrafts, demons, and others, sorcerers. People with hysteria, usually the women, were considered evil or possessed by the evil spirit. So the proposal by Freud that people can convert unexpressed emotions into the physical symptoms. So yun kay Freud. So that is for hysteria. In the somatizations, this development, the transference of mental experiences, states into the body symptoms. So that is for somatization. Somatizations is defined as transference of mental experiences and states into the bodily symptoms. Somatic symptoms illnesses uh, can be characterized as the presence of physical symptoms that suggest medical conditions without a demonstrable organic basis to account fully for them. So there are three central features of the somatizations. Number one, we have the physical complaints, suggest major medical illness but have no demonstrable organic basis. The other one, we have the psychological factors and conflicts. Seems important in initiating, exacerbating, and maintaining the symptoms. And lastly, we have the symptoms or magnified health concern are not under the client's conscious control. So clients are convinced they harbor serious physical problems despite of the negatives result during the diagnostic testing. So they actually experience the physical symptoms as well as the accompanying pain, distress, and functional limitations such symptoms induce. So clients do not willfully control the physical symptoms, although their illnesses are psychiatric in nature, so many clients do not seek help from mental health professionals. We have the types of somatic symptoms illnesses. We have the somatic symptom disorder, we have the conversion disorder, we have the pain disorder, and we have the illness anxiety disorder. In the somatic symptom disorder, that is characterized by one or more physical symptoms that have no organic basis. So the individuals spend a lot of time and energy to focus on the health concern, often believe symptoms to be indicative of serious illness and experience significant distress and anxiety about their health. While in the conversion disorder, sometimes called conversions reactions, involves unexplained, usually sudden deficit in sensory or motor function. So example here, the paralysis and blindness. So those deficits suggest a neurologic disorder but are associated with psychological factors. There is usually significant uh, functional impairment. So there is a significant functional impairment. There are maybe an attitude of the level or level indifference. That is when we say level indifference, that is a seeming lack of concern or distress about the functional loss. In the pain disorder, has the primary physical symptoms of pain, which is generally unrelieved by analgesic and greatly affected by psychological factors in terms of onset, severity, exacerbations, and maintenance. And lastly, in the illness anxiety disorder, formally the hypochondriasis, is the preoccupations with the fear that one has a serious disease or the disease convictions or will get a serious disease or the disease phobia. It is a thought that the client within disorder misinterpret bodily sensations or functions. So in the onset and clinical course, clients with somatic disorder often experience the symptoms in adolescence. The diagnosis may not be made until early as adulthood. Okay, so conversion disorder usually occurs between the ages of 10 and 35 years. Pain disorder and illness anxiety disorder can occur at any age. So all symptoms illnesses are either chronic or recurrent. Okay, so lasting for decades for many people, clients with somatic symptom illness and conversion disorder most likely seek help for mental health professionals after they have exhausted efforts at the finding of diagnosed medical conditions. Clients with illness, anxiety, or pain disorder are unlikely to receive treatment in the mental health setting unless they have a comorbid conditions. So clients go from one physician or clinic to another or see multiple provider at once to obtain the relief of the symptoms. And the clients tends to be pessimistic about the medical establishment. Questions. Is the following statement is true or false? So a client with somatic symptom illness is able to voluntarily control the symptoms. The answer is false because the symptoms of somatic symptoms illness are under the client's voluntary control. So clients truly experience the symptoms they report. They are not making it up or fabricating symptoms. while psychologically or perhaps even subconsciously, clients need or want attention, the illness. Okay, perhaps even subconsciously, the client's need or want attentions. The illness is not purposeful attention seeking or overtly manipulative behavior. So we have the related disorder. We have malingering. We have factitious disorder. Okay. So in malingering is the intentional productions of false or grossly exaggerated physical or psychological symptoms. It is motivated by external incentives as external incentives such as avoiding work, evading criminal prosecutions, obtaining financial compensations, or obtaining drugs. So, people who malinger have no real physical symptoms or grossly exaggerate relatively to the minor symptoms. Their purpose is some external incentives or outcome that they view as important and result directly from the illness. People who malinger can stop the physical symptom as soon as they have gained what they wanted. Okay? In factitious disorder or imposed on self, occurs when a person intentionally produces or paints physical or psychological symptoms solely to gain attentions. People with factitious disorder may even inflict injury on themselves to receive attentions. So the common term for factitious disorder imposed on the self is Munchausen syndrome. So yan yung tawag natin. Aberration of factitious disorder that is imposed on others is commonly called Munchausen syndrome by proxy, and occurs when a person inflicts illness or injury on someone else to gain attentions and emergency medical personnel or to be a hero for saving the victim. So, for example, a nurse would a nurse be a give excess intravenous potassium to clients and then save his life by performing cardiopulmonary resuscitation. So that is factitious disorder or imposed on other. And we have the medically unexplained syndrome or MUS or functional somatic syndrome, the term used more frequently in general or in the general medical setting. They refer to physical symptoms and limitation of functions that has no medical diagnosis to explain their existence. Okay. Okay, let's proceed to the etiology. In the psychosocial theories, believe that people with somatic symptoms illness keep stress, anxiety, or frustrations inside rather than expressing them outwardly. So this is called internalizations. Clients express the internalized feeling and stress through the physical symptoms, which is the somatizations. Both internalization and somatizations are unconscious defense mechanisms. So, clients are not consciously aware of the process and they do not voluntarily control it. So, people with somatic symptoms, illnesses do not readily and directly express their feelings and emotions verbally. So, some experience alexithymia, alexithymia, or the inability to identify the emotions. This is the different than unwillingness of refusal to identify the emotions. They have tremendous difficulty dealing with interpersonal conflict. So, when placed in situation involving conflict or emotional stress, their physical symptoms appear worsen. So, the worsening physical symptoms help them meet psychological needs for security, attentions, and affection through primary and secondary gain. So in the primary gain are the direct internal benefits that being sick provides, such as relief of anxiety, conflicts, or distress. While in the secondary gains, that is the external or personal benefits received from others because one is sick, such as attention from the family members and comfort measures. So, somatization is associated most often with a woman, evidenced by the old term hysteria. Okay? So, yung old term hysteria natin, that is ancient theories believe that explain female pains resulted from migrations of the uterus throughout the woman's body. Next one, in the uh, biological theories. Research has shown the differences in the way clients with somatoform disorder regulate and interpret the stimuli. So this client cannot sort relevant from irrelevant stimuli and responds equally on both types. In other words, they may experience a normal body sensation such as peristalsis and attach pathologic rather than a normal meaning to it. So there is a too little inhibitions of sensory input amplifies awareness of physical symptoms and exaggerate response to bodily sensations. In our cultural considerations, the types and frequency of somatic symptoms and their meaning may vary across culture. So there is a neurologic symptoms of somatization disorder in Africa and South Africa and South Asia include burning hands and feet and non-delusional sensations of worms in the head or hands under the skin. So there is symptoms related to male reproductions are more common in some countries or culture. Okay, as we can see, the variable in frequency meaning across the culture. Pag sinabi nating that is culture from India. So, ang characteristic dyan, that is hypochondriacal concern about the semen loss. Okay? Koro, in Southeast Asia, they believe that penis is shrinking and will disappear into the abdomen, resulting in death. Falling out episode. That is from southern United States or Caribbean and Caribbean islands. That is the sudden collapse. Person cannot see or move. Wa Byong in Korea, that is suppressed anger, causes insomnia, fatigue, panic, indigestion, and generalized ache and pains. We have sangue dormido, that is from Portuguese, that is characteristic of pain, numbness, tremor, paralysis, seizure, blindness, heart attack, and miscarriage. And Shengjin Shuriao or Suryorio that is from China, that is characteristic of physical and mental fatigue, dizziness, pain, headache, sleep disturbance, memory loss, gastrointestinal problems, and sexual dysfunctions. So, yon ang ating mga cultural considerations. So, many cultural concept of distress has corresponding to the somatic symptoms not explained by the medical conditions. So, yun. So, yung ating koro, falling out episode, wabyong, sangge dormido, and senjing shoryo. Treatment. In our treatment for somatoform disorder, focuses on the managing symptoms and improving the quality of life. So the healthcare providers must show empathy and sensitivity to the client's physical complaints. So a trusting relationship helps ensure clients stay with and receive care from one provider instead of doctor shopping. So we need the symptom management and improve the quality of life. And we have the antidepressant for accompanying depression, which is the SSRI. So yung ating antidepressant na kwan natin. So it can be the Prozac, Paxil, and Zoloft are the antidepressant for accompanying the depression. So kapag yung Prozac ang ibigay natin, we need to monitor the rash, hives, insomnia, headache, anxiety, drowsiness, nausea, loss of appetite, and avoid alcohol. For Paxil naman, we need also to monitor for nausea, loss of appetite, dizziness, dry mouth, somnolence, or insomnia, sweating, sexual dysfunctions, and alcohol or avoid alcohol. And lastly, in SOLOP, we need to monitor nausea, loss of appetite, diarrhea, headache, insomnia, sexual dysfunctions, and avoid alcohol. And then, if there is a chronic pain, referral to chronic pain clinic. So, importante yun. Kasi nga, for clients with pain disorder, referral to a chronic pain clinic may be useful. So, clients learn methods of pain management such as visual imaging and relaxations. And we have the involvements in therapy groups is a beneficial for some people with somatic form or somatic symptoms illness. So clients with somatic symptoms disorder, anxiety illness disorder who participated in structured cognitive behavior group showed evidence of improved physical and emotional health. And then we have the educations. In educations or providing information as also effective for clients with somatic illness or symptoms. So reading the both internet-based educational material and books were other effective therapies. Questions. Is the following statement is true or false? A client with factitious disorder develops symptoms primarily for attentions. The answer is true. Factitious disorder occurs when a person intentionally produces or paints physical or psychological symptoms solely to gain attention. So, somatic illness and nursing process implications or applications. So, in assessment, we need to then we need first one to the nurse must investigate the physical health status thoroughly to ensure there is no underlying pathology requiring the treatment. So usually for the past kapag magkakaroon tayo ng investigations on the physical health status or screening, titignan natin yung assessment somatic symptom for the severity. So for the past 4 weeks, each of the following symptoms is rated. So titignan natin the stomach pain, back pain, pain in arms, legs, and joints, menstrual cramps, or other problems with periods. We have the headaches, chest pain, dizziness, painting. So, yan yung titignan natin in terms of the investigations. Okay. Next one, we need also to see to it the history. In history, the clients usually provide a lengthy and detailed account of previous physical problems, numerous diagnostic tests, and perhaps even a number of surgical procedures. So, usually, dito sa history, usually detailed medical history and distress about the health status. So, except with the client conversion disorder, who displays the labile indifference. In the general appearance and motor behavior, uh, the overall appearance is usually not remarkable. Often, clients walk slowly or with unusual gait because of the pain or disability caused by the symptom. So, they may exhibit a facial expressions or of discomfort or physical distress. So, yun yung makikita natin in terms of the general appearance and motor behavior. In the mood and affect, mood is often labile, shifting from seeming depressed and sad when describing physical problems to looking bright and excited when talking about how they had to go to the hospital in the middle of the night by ambulance. And then the emotions are often exaggerated as report of physical symptoms. So the clients describing a series of personal crises related to their physical health may appear pleased rather than distressed about this situation. So usually, ang mood and affect nila, we have the label and exaggerated emotions. Okay, in the thought process and the content, we see to it the thought is unlikely to be able to think about the emotional feelings. Focus on the physical health and sensations. Okay? For the thought and uh, processes. So, clients who somatize do not experience disordered thought process. The content of their thinking is primarily about often exaggerated the physical symptoms or physical concern. For example, when they have a simple cold, they may be convinced it is a pneumonia. They may even talk about dying and what music they want to play at their funeral. Okay. In the sensorium and intellectual processes, clients are alert and oriented. Intellectual functions are unimpaired. Okay? In the judgment and insights, exaggerated responses to their physical health may affect clients' judgment. They have little or no insight into their behavior. They are firmly convinced their problem is entirely physical and often believe others don't understand. So there is little or no insight into the behavior. In the self-concept, clients focus only on the physical part of themselves. They are unlikely to think about personal characteristic or strength are uncontrollable when asked to do so. In the self-conscious, we focus on the physical health of our clients. In the roles and responsibilities or roles and relationship, clients are unlikely to be employed, so they may have a past work history. They often lost job because of excessive absenteeism or inability to perform work. So our clients may have quit working voluntarily because of the poor physical health. And in the physiological and self-care concern, uh, in addition to multitude of physical complaints, these clients often have legitimate needs in terms of their health practices. So clients who somatize often have sleep pattern disturbances, lack basic nutrition, and get no exercises. So in addition, they may be taking multiple prescription of pain or other complaints. Or in client has been using anxiolytics or medication for pain, the nurse must consider the possibility of withdrawal. In the data analysis and nursing diagnosis, commonly used when working with client with somatomize includes ineffective coughing, ineffective denial, impaired social interaction, anxiety, disturbed sleep patterns, and fatigue and pain. So, yun yung mga pwede nating nursing diagnosis. Clients with conversion disorder may be at risk for disuse syndrome for having pseudoneurologic paralysis symptoms. In other words, if our clients do not use limb for a long time, the muscle may be weakened or undergo atrophy for lack of image. So our outcome identifications, the treatment outcome for client with with the somatic symptoms illness may include identify the relationship between the stress and the symptoms and the physical symptoms, verbally express the emotions and feelings, establish and follow a daily routine, demonstrate alternate ways to deal with stress, anxiety, and other feelings, demonstrate healthy behavior regarding rest, activity, and nutritional intake. So our interventions, number one there is provide health teaching. So we need to improve health behavior. So the nurse must help the client learn how to establish a daily routine that includes improve the health behavior, especially the adequate nutritional intake, improve sleep pattern, and realistic balance of activity and rest are all areas with the client may needs assistance. Next one, we have the clients express emotions, especially expressing the emotions. So teaching about the relationship between stress and physical symptoms is a useful way to help clients begin to see the mind-body relationship. So the clients may keep a detailed journal of their physical symptoms. Okay, so pwede natin gawin yon journaling. And then limiting time focus on the physical complaints. And then we have the teaching coping strategies. Two categories of coping strategies are important for clients to learn and to practice. We have the emotion-focused coping strategies that is help clients to relax and reduce feelings of stress and problem-focused coping strategies naman which help resolve or change clients' behavior or situations or manage the life stressor. So the emotions focus strategies include the progressive relaxations, deep breathing, guided imagery, and distractions such as music or other activities. So yung pwede natin gawin. In problem-focused coping strategies includes learning problem-solving methods, applying the process to identify problems, and role-playing interactions with others. And lastly, we need to evaluate. Somatic symptoms illness are chronic or recurrent, so changes are likely to occur slowly. So if treatment is effective, the client should make fewer visits to physician as a result of the physical complaints, use less medications and more positive coping techniques, and increase functional abilities. So improve family and social relationship are also positive outcome that may follow improvements in the client's coping abilities. So, community-based care. In our community-based care, appropriate referrals such as pain clinic for clients with pain disorder, informations about the community support groups, and lastly, we have the encourage pleasurable activities or hobbies. Questions. Which of the following example of problem-focused coping strategies? Answer here is interaction role playing. So interaction role playing is an example of problem-focused coping strategies. So example here, the progressive relaxations, deep breathing, guided imagery are emotion-focused coping strategies. So in our mental health promotions, a common theme in somatic symptom illness is their occurrence in people who don't express conflicts, stress, and emotions verbally. So they express themselves through the physical symptoms. The resulting attention and focus on their physical ailments somewhat meet their needs. As these clients are better able to express their emotions, and needs directly, physical symptoms subside. So thus, assisting them in dealing with emotional issues directly is a strategy for mental health emotions. So mental health promotion. So assist our clients in dealing directly with emotional issues, assist clients in continuing to gain the knowledge about the self and emotional needs, and we have the cyberchondria. In cyberchondria, that is refers to excessive or repeated online searches for health-related information that is distressing or anxiety-provoking for the person. So, a person anxiety about his or her health increase as more time is spent online seeking the health informations. Lastly, we have the self-awareness issue. Deal with feelings of frustrations. Be realistic about the small successes. Accept the client his or her continued complaints without being judgmental. Validate the client's feeling, and remember the complaints are not under client's voluntary control. So the client with who cope with physical symptoms can be frustrating for the nurse. So initially they are unwilling to consider that anything under the major physical illness is the root of all their problems. So the health professional tells client there is no physical illness and refer them to mental health professional. The response is often anger. So to enhance going the relationship, the nurse must be able to accept the client's his or her continued complaints and criticism while remaining the non-judgmental. So remember that the somatic complaints are not under the client's voluntary control. The client will have fewer somatic complaints when he or she improves coping skills and interpersonal relationship.